Firstly, I'd like to introduce myself. My name's Mark Wheeler. I'm the Director of Health and Medical Industries for the Department of Trade and Investment in the state government. So I'd like to, thank Cara and John and the team at ABMC for the opportunity for our team and myself to come and chat to you guys. We've been asked to come and talk through some of the work that the Department for Trade and Investment is doing in some of this space, and in particular the MIT Bigdata Living Lab project, which we helped bring to Adelaide, and it's a really exciting part of the high tech and digital health capability in South Australia. So probably before we get too far along, I'd like to acknowledge that the lands we meet on virtually today, the traditional lands of the Kaurna people, and that we respect their spiritual relationship with country. We pay respect to their elders past and emerging. A little bit of housekeeping before we get too far in. This session is being recorded, so it will be available afterwards on the ABMC website. If you have any questions, there's a Q&A box there. Pop them in there and I'll pull them up at the end. But before I sort of introduce our speaker for the day, Stuart Davis, who you can also see there online, I thought I'd briefly talk a little bit about the Department of Trade and Investment. It might not be too familiar to everyone, and in particular a little bit about how we work. DTI is essentially an outwards facing commercial agency of government. We work in 9 focus industries, and we work with industry. That sits across defence, space, food and agriculture, mining, tourism, international education, high tech, the creative industries, and the health and medical industries. So we have, I guess, a really diverse portfolio. We have small teams that work in each of those sectors. And we also have a presence in global markets. So we work in the US, China, the UK, MENA in India, Japan, Korea, Singapore, Hong Kong, and we've hopefully got a couple more footprints opening up internationally. So I guess what this means is that within government, DTI has a fairly good ability to engage globally, to work with leaders and investors and innovators. It also gives us, I guess, the opportunity to look at global trends and the opportunities that uncovers, and also I guess to be able to bring that back to our local landscape in South Australia, and I guess build a view about where we are competitive and where our capabilities are in the state, and where that I guess might be interesting to the world. So that sort of leads, I guess, to a key part of our strategy in DTI is to be forward looking around those opportunities and what we have in South Australia. And I guess it really means, trying to build the future, but also testing, those ideas and opportunities in the reality of what commercial interest might be. So a great example of all of that is how this is being done in sort of strategic and practical terms with the work that we have done with the MIT Bigdata Living Lab. So I guess it's an exciting and really interesting project, and so in that context, I think it would be sensible to introduce our speaker for today, Stuart Davis. He is also sort of part of the health and medical and high tech team in the department. His focus, is really on growing the digital health sector in South Australia. He leads the state's efforts to attract investment. And he really, I guess, looking to engage with some of the world's most forward-thinking and innovative digital health and technology organizations. He's been working across the digital health ecosystem for quite a while now, to establish partnerships with the world's leading technology organizations and to develop innovations in Adelaide that will help transform the health outcomes and generate commercial opportunities globally. So prior to this, Stuart was a business development manager with SOMARC, working in between their San Diego and Adelaide operations. And I think he comes to us with a bachelor in arts and technology from Flinders University. So I guess without too much further ado, Stuart, I'd invite you to take us through some slides that sort of introduce the Living Lab.
Thank you, Mark. Hi, everyone. As Mark mentioned, Stuart, thank you for the time. Really pleased to get this opportunity to speak to you. For the last 18 months, I feel I've been very fortunate to be working with the team at MIT around the Living Lab and supporting that capability in South Australia. I've also been, I feel quite lucky to be sitting on the executive team that meets and shapes the way in which the lab is working here in the state. So I know the team initially reached out to the guys at MIT to see if they'd be happy to give a presentation, but it's after 1 a.m. in the morning there, so I'm substituting in. So hopefully I do it justice. So the MIT Bigdata Living Lab is a collaboration between MIT Connection Sciences out of Boston in the US, commercial partners here in Australia, and the state government. The lab itself is completely funded by the commercial partners and includes participation from Department for Trade and Investment and Department for Premier and Cabinet. So MIT Connection Sciences was brought up out of the capability of the MIT Media Lab. It's intended as a worldwide alliance to improve the outcomes for the world using AI and data analytics. There's a significant focus on privacy, trust, and security of data, but really it's about driving effective and ethical behavioral change using these technologies. So it includes working with the United Nations, providing consultation to different countries, so particularly with technologies like cryptocurrency and blockchain, and also working with different organizations, like in Australia here with Data 61. And there's a small startup called Viridia that the MIT Connection Science have been working with. They recently announced a collaboration with the Bermuda Health System, providing rights management to the entire health system using blockchain technology. Viridia are also consulting to Data 61 on using rights management for genotype data as well. So a really interesting global footprint that has the capability to really change the direction for the world. So I'll go through and just introduce some of the people that we've been working with through MIT Connection Science. So the capability is led by Professor Sandy Pentland. He's one of the most cited computational scientists in the world. He's got a Rolodex that includes presidents and prime ministers, and a couple of times we've been in meetings with him where he'll say, I've got a connection into that country, but then realize it's not a contact that we can call because they're running the country. He's also involved and co-led the workshops with the World Economic Forum around GDPR, and he's involved in the IEEE and leads the AI ethics component of that, or chairs the board that drives it. Sandy's really interesting person to have in meetings. He's often very quiet, but he'll say one sentence that'll completely elevate the discussion to having a much grander vision than otherwise would be. So he's a really great person to work with and has a really keen focus on benefiting society. The other leader at MIT Connection Sciences that we're working really closely with is Dr. Thomas Hajano. He gives us a lot of advice and consultation around security and privacy for data. So he's the Chief Technology Officer for MIT Connection Sciences, but he was also involved in writing some of the code for Microsoft Windows, particularly the Active Directory component. So a really strong data security expertise. In the work we've been doing with the MIT Bigdata Living Lab, we've been working closely with several members of Sandy Pentland's team. So Mawson and Isabella are two data scientists that are over in Boston working under Sandy. They've been working on several projects here that I'll touch on a little bit. Mawson originally was from Turkey, where there's also another MIT Bigdata Living Lab over there. So that relationship across in Turkey has given Mawson the opportunity to move over to Boston and become part of the team there. The other person down the bottom is Tobin South. You might have seen a fair bit of content across LinkedIn late last year when Tobin won a Fulbright scholarship. So previously a master's student at Adelaide University, the scholarship takes him over into the US to be working in Sandy's team. And I think one of the big exciting opportunities with the Living Lab is having that relationship into MIT and the opportunity for students out of the three major universities here to cross with the MIT team and share that education experience. Tobin has also been sitting on the executive team for the Living Lab, and so it's been great to have someone who is over in MIT, entrenched in Sandy's team, but has a deep and intimate understanding of South Australia and the capability of groups like the Australian Institute of Machine Learning. So the Living Lab is located at Lot 14, so it's in the basement under Stone and Chalk, just behind the community cafe there. It's a co-working space that is managed by DTI. So our colleague Ivor looks after the day-to-day component of the lab itself. And I think one of the exciting things for us is it's a great space where when we're talking to organisations about investment into South Australia, some of the early team are able to work out of that location to get started in the state. So at the moment, the Digital Health CRC are working out of there. There are staff from Microsoft, Salesforce and Nokia working from there as well. And I think it's a great opportunity for an innovation type focus where it enables and facilitates those water cooler conversations where someone might be working on a project and just have an off-the-cuff conversation and realize that maybe the technology that Microsoft has will be able to do something that's never been done before. So the view for the Living Lab and the physical space here is really about driving innovation. And I think the feedback we've had from organisations working there is really exciting, but also the potential for impact is exciting as well. So the Living Lab has been established with a focus on improving socio-economic outcomes for South Australia. And so it really aligns with that MIT Connection Sciences ambition that was outlined earlier. Part of that's attracting investment into the state. The Living Lab itself works around trying to find innovation around or insight that comes from movement data, spending data, and also government data. And then the other ambition for the lab is to foster collaborations around AI and data analytics and really help with that translation of research into commercialized business opportunities. I think many of you might have seen over the last 12 months the exciting momentum we've had around investment into South Australia, particularly with a high-tech focus, and MIT have been involved in a lot of these conversations. So I think for Mark, Sandra and myself, as we've been speaking to organisations that are considering investment into South Australia, often we'll introduce them to the Australian Institute for Machine Learning, stakeholders, say at SAMRI, like Steve Westling and Yvette at Adelaide Biomed City. Particularly within health, we've been working a lot with the state's Chief Commercial Information Officer, Dr. Santosh Verghese, but then also the team at MIT. And I think it's been a really interesting process where for the state, these organisations are really excited about the capability in the state. Australian Institute for Machine Learning being ranked number 2 to 3 in the world for computer vision last year is something that really gets their attention. And then the MIT capability really complements that. So, it's interesting seeing these organisations get really excited about the potential to work with MIT. And I think the piece that I've really appreciated is with these organisations, as they're speaking to Sandy and Thomas and they're getting excited about the potential for these partnerships, Sandy and Thomas are great at saying, look, we'd love to work with you. We're really keen. We can do some exciting things, but you need to be in South Australia. So that they're a great partner in terms of driving investment into the state. And you can see over the last 12 months, we've had more than 5,000 jobs here, which is an amazing bit of momentum. So a couple of the projects that we're working on with the MIT team, one is the Atlas of Opportunity. So this has been developed in leveraging ABS data as well as state government data and data from the commercial partners Optus, DSpark and Bank SA that we mentioned at the beginning. This is intended as a tool to help SME and startup businesses get insight to the economic nuances of the state and make informed business decisions. So It provides insight into things like where the population in the state live versus where they work, down to a postcode level, and also the transaction of money across these different jurisdictions. So where's money flowing out of and where's it flowing into? And the intention is for it to be able to guide decision-making of these businesses, so that if they want to expand and open up a new office or expand a franchise, then they've got information that guides these decisions so they can be more effective rather than it just being guesswork. This project was sort of guided or led by Sandy, but a lot of the work was done by Mawson. The way Sandy describes it is the functional capability that's set up becomes a Swiss Army knife. So while it started with a focus on supporting SMEs, it also allows the ability to insert other pieces of data that then inform different sorts of decision making. So we can see on the left, we're able to track the carbon footprint, and this information will be able to help the state make decisions and design policy as we transition to a green economy. On the right side, you can see some information about health scores. So there's been a lot of focus on how we can unlock health information down to a postcode level and get insight on things like diabetes and whether there are specific postcodes with a higher incidence of conditions like diabetes, and then work out why that might be. Are there a glut of fast food areas in that space that maybe make it difficult to find healthy options? Is there less parkland or gyms or those sort of facilities that allow exercise? So the goal of this is very much to provide data and insight that will be able to guide where health facilities are set up and how healthcare is provided, but also drive policy. And hopefully having this information here allows there to be a visibility of the transition in these spaces over time. So if you look at carbon footprint or health scores in 2022, what are we doing to improve that? And are we seeing a difference in 5 years? I think one of the really exciting pieces about the opportunity to work with the team at MIT Connection Sciences and the Living Lab is to be really ambitious and look for projects that are going to have an impact globally and really transform the society we have here in South Australia. So one of these projects is a global digital asset system, so GDAS project. We're in a region in the world that is one of the fastest growing areas in the APAC region. Cryptocurrency and blockchain technology is one of the fastest and most disruptive technologies, completely developing at a rate that's much more significant than the initial internet adoption was. So having a focus where we're driving innovation in the nexus of these two pieces will position South Australia to take a lead within innovation in that space. So the Global Digital Asset System project is being developed in partnership with the World Bank, the Federal Australian departments that are focused across this area, so Border Force, Australian Taxation Office, as well as DFAT, also working with groups like the CSIRO, Data 61, and then international commercial stakeholders like TradeLens, the EY Global Tax team out of New York City, and IBM and Microsoft. So these projects bring in global stakeholders that are connecting us through to innovation teams all across the world and making sure that we're connected into that network rather than being isolated, making decisions and driving our activities by ourselves without being connected to the global network. So the Global Digital Asset System project is really looking to drive the transition from paper-based records to a completely digitized global trade network. It'll allow the collection and analysis of information right from things like growing a crop, so looking at the genetic makeup of the crops that are grown, environmental factors as they're move through to maturity, and then information about harvesting and how they're then shipped through to the ports, so perhaps Flinders ports, and then off to our international partners and customers. The value of transitioning to this global platform means that, one, you've got a digital record of every stage that then allows analysis and insight. So we can get an understanding of things like, all right, well, what's the genetic makeup of this grain and is that impacting health? But it also allows a much more efficient process. So instead of a truck going and picking up some grain and then going to Flinders ports and then sending that through to an international partner, and every stage paper records being updated, that process is all automated and digitized. The other benefit of that is that it automates the taxation process. So at the moment where there is slippage, and EY have proposed that that's somewhere between 4 to 6%, the digitization of that process means that we've got an automatic process that ensures the revenue generation that comes from taxation to pay for things like healthcare and the infrastructure that we appreciate as a society. One of the big areas that we've been working a lot with MIT around and leveraging their advice is healthcare. And this is, I'm sure, particularly of interest to this group. A couple of weeks ago, PwC announced their investment into South Australia, and the opening was given by Tom Seymour, who's their CEO. One of the reasons he gave for investing into South Australia was that he sees the state positioning itself as a leader for innovation, not just across Australia, but across the APAC region, particularly with cloud and AI innovation. But the other comment he made was that as momentum comes in the state across this high-tech field, it will then be specific sectors that start to benefit from that. So health and medical is one of the biggest sectors that has the greatest potential to benefit from high-tech innovation. And that's where the South Australian Health Department, SA Pathology, the Australian Institute of Machine Learning, SAMRI, Adelaide Biomed City, and the Digital Health CRC are all partnering and having conversations around how we can establish South Australia as a hub for technology-driven healthcare innovation. So if we look at AI and data analytics across healthcare, then how can we use that technology to enable predictive and preventative care? Are we able to recognize conditions much earlier and then treat them before they become chronic? Are we able to provide easy decision-making tools that allow clinicians to have the information they need to make informed decisions in a way that supports their existing workload? We've got clinicians that are working 12 hours a day, they're overwhelmed with information. So how do we use these tools to assist them with their work and improve health outcomes? And then also driving benefits around speeding up manual tasks and time-consuming tasks and transitioning to AI-driven capabilities that really change that. On top of improving population health outcomes and reducing costs. The current rate of increase of costs for the healthcare system annually is somewhere around 4 to 5%, whereas our taxes aren't increasing. So we've got this capability around healthcare that is incredibly important to all of us. How do we transition and leverage technology to ensure that we're delivering solutions that improve the quality of health outcome, while also making sure they can be maintained with a limited taxation pool? One of the other key areas that we're working and discussing with MIT Connection Sciences is that there's this amazing benefit that comes from AI and data analytics. But how do we navigate that so that we get these benefits while still preserving the security and privacy of health data? How do we ensure that a 10-year-old child with cancer is not able to be identified by anyone outside the healthcare system? But are we then able to link up different data assets like a healthcare biobank to EMR data to research data so that we can get insight that helps us develop improved treatments and different technologies that translate healthcare? So hopefully that gives you a good background of the MIT Bigdata Living Lab, how it's made up, where it's located, and then a couple of the projects that they're working on, particularly with a focus on healthcare. I think it's a really exciting opportunity to work with a team from MIT. It's great that it's sort of built around a capability here in South Australia, and as a community, I think it's really exciting that we can all benefit from this and hopefully really change the outcome for South Australia. To everyone, I hope that was helpful. I'm really keen to hear any questions, and thank you so much for your time.
Thank you, Stuart, and nicely put. And look, I think for our department, and I think lots of other stakeholders, it's a really exciting project because of the way MIT is able to sort of elevate and bring people together and think through some of these really challenging issues that need to be addressed to enable some of these sorts of benefits and projects like you're talking about. And Paul's given us a question here, which I think hones right down to the issue. He said, how do we unlock the potential of big data in healthcare? We have a single electronic medical record in the public sector with over 1 million records, but have struggled to unlock the potential for public good while addressing privacy concerns. So I know you've got plenty to say on that, but did you want to comment on that, Stuart?
Absolutely. Thank you, Paul. I think that's the big question, right? Like we know we've got this amazing health data asset. It's certainly something that we've recognized in the conversations we've had with organizations that are interested in investing here. That's kind of the piece where AI leaders and data scientists, their eyes light up and they get really excited. MIT are providing guidance, so they have been working with Dr. Santosh Verghese for about 12 months and helping him to sort of shape some of his thinking and providing support in this space. There are a couple of initiatives around how we can unlock that data. They're in their early stages and we're working through them. Probably just as a bit of insight or background, so Thomas Ojano has introduced it to some of the world's leading research teams in this space. So we've been speaking to the head researcher out of Intel, and they develop hardware chips that allow hardware to manage the security of this data and ensure that it's encrypted at all times. So if it was done just by software, then it would be the processing to analyze that data is really slow, whereas a hardware solution improves that. We've also had introductions to IBM. So there are conversations on how we unlock that and work out what a solution is for South Australia. While Santosh has been working on it for a year and driving that benefit within the health system, the next challenge is how we expand beyond that. So conversations are progressing, but they're still in early stages.
Mm-hmm. Nicely put. Look, I could probably keep banging on with more questions, but we're right up against time limit there. So I think you've sort of really given a nice overview there. So I think feedback and comments are certainly invited. And as the Department for Trade and Investment, we are very interested in collaborating with people in the Biomed City around these opportunities. Paul's comment there is just that there's some really interesting developments at the coalface in health services also he's happy to share. So Paul, I think we might connect on the back of this, and likewise anyone else listening, like we're really interested in the collaborations and how we bring these sort of challenge spaces to industry and to the solutions that are needed. I also should mention the presentation will be uploaded onto the ABMC website shortly, so you can pick it up there. And last but not least, I think next Tuesday's presentation is on AHIP with a presentation from Jenny Richter and a panel with Leslie Dwyer, Stephen Rodder, Andrew Zenatino, and Steve Westling will be chairing that one. So I think thank you everyone for attending today, and thank you, Stuart,